My fellow residents, as we face the approaching storm, it's important that we all stay informed and prepared. I would like to share some key information to help you and your loved ones remain safe and secure. Firstly, to the constituency of Prospect. All necessary arrangements have been made with the relevant Minister of Pahi to ensure that stormwater management will be taken care of. Approximately a week ago, in working with Minister J.E. Banks, a pump system was placed at the back of Mangrove Avenue to remove storm water from the area, aiding to less flooding within the area and keeping our people safe. For those who are long-term residents of Prospect, we know that this is an area where the water table is very high and we're prone to flooding. This has already proven its success with the rains being had a week ago. And I have been told that once the rains begin, this pump will be started and it will work during the night to aid in keeping the water at bay. I have also been informed that all of the garbage collections have been done and that they are focusing more on low-lying areas at this time. People would have seen from our local community WhatsApp chats that plywood that has been delivered to 33 Marina Drive has been distributed to residents of the Prospect constituency for those needing to shelter in place. I want to let my Prospect people know that I am here and we will weather this storm together. Again, in regarding waste management on a national level, our efforts will be focused, as I rightly said before, residents in low-lying areas. And we are kindly asking you to secure your garbage and use the 24-hour drop-off site at the entrance of the Georgetown landfill for small amounts of residential waste. For those of you who may be feeling anxious ahead of the storm, please know that support is available. You can contact K-Mind at 1-800-534-6463. Now to our patients requiring special medications. Please ensure that you have at least a 2-week supply. If you need additional supplies, contact the Cayman Islands Hospital at 244-2715 or 244-2716 with your full name, doctor's name, and prescription details. Arrangements will be made for you to collect these medications from the Smith Road Pharmacy. It's critical that your medication is in a watertight container to prevent any loss or damage. Please stay tuned to the public service announcements for updates on prescription and pharmacy hours. To our expectant mothers, if you're experiencing contractions or in your 3rd trimester, please reach out to your physician for guidance. If you need to evacuate, remember to take your prenatal care records, birth bag, and a 2-week supply of any medications, including parental vitamins. Reducing stress is essential, so plan and prepare early to ease your mind. To our oncology and hematology patients, if you are receiving active treatment, please contact the chemotherapy unit on 244-2872 or 244-2706 to make necessary arrangements. For our dialysis patients, it is crucial that you contact the dialysis unit at 244-2769 or 244-2624 immediately to ensure that your treatment continues without interruption. Now, in the event of a storm, please remember that the Georgetown Hospital is not a shelter. We have 9 designated emergency medical centers equipped to provide medical services and care during the hurricane. These centers include Prospect Primary School, John A. Cumber Primary School Assembly Hall, William Allen McLaughlin Civic Center, Cradock Ebanks Civic Center, Clifton Hunter High School Gymnasium, Bodentown Primary Multi-Purpose Hall, Savannah Primary School Assembly Hall, Aston Rutty Centre on Cayman Brac, and the Public Works Department building on Little Cayman. Please bring your medications and necessary supplies with you. If you require a caregiver, they must accompany and stay with you at the shelter. Now, certain individuals should go to the emergency medical services, including those dependent on oxygen or ventilators, wheelchair-bound persons with medical needs, those with severely reduced mobility, and individuals with acute mental illness. Emergency medical services will also provide care in the community after the hurricane if health centers or hospitals are affected or if roads are impassable. Admission to the hospital is necessary for needing recurring professional medical care, special equipment, or continuous medical surveillance. This includes pregnant women in labor or their third trimester, individuals requiring continuous IV therapy, those experiencing chest pain or shortness of breath, with those serious having injuries, communicable diseases requiring isolation, uncontrollable or violent behavior, and infected wounds. For those persons requiring overseas treatment, please ensure your travel documents are valid and are up to date. Check the expiry dates of your passports and visas, and contact the passport office for any renewals. Maintaining current health insurance is also vital. Emergency medical services will be available at the Cayman Islands Hospital and all designated emergency medical services. During the hurricane, emergency calls will be responded to based on a risk assessment. Remember, our EMS vehicles do not operate in tropical storm force winds, so only seek treatment for true medical emergencies. Please label and secure all important medications in watertight containers for easy access by emergency medical services responders. Lastly, please ensure that your house numbers are visible. This will help emergency services find you quickly in a time of crisis. Your address numbers should be placed on or beside your front door in a contrasting color and lit or reflective. If your door is not visible, place the number on a post, a gate, or fence. Keep the view of your house numbers clear of any obstructions. Let's all take these steps to ensure our safety and well-being during these challenging times. Stay safe, stay prepared, and take care of each other. Thank you.